Hi. About a year ago, I had an operation on my neck. I had full recovery in 7 months. And in my condition as it was, I believe it was absolutely necessary. In short, my surgery was successful. To share this experience is because I think there are many people out there maybe are facing the same problem as I had, asking themselves the questions like, is my condition surgical? Are there alternative approaches other than surgical solution? Anterior or posterior? Which one is more appropriate for me? Also, will I miss the best chance to get the best result of it? Should I do it now or should I wait and see? Well, I will share my experience and discuss all about it from a patient's empirical point of view. Before I had this surgery, I generally consider myself a healthy and sportive person, totally unaware of my latent condition. Medical term is called cervical stenosis, which means my nerve got pinched in its passage inside my spine. I was totally unaware of this latent condition until one night before I went to bed. I had such severe pain in my neck, which was 5 months prior to the actual surgery. In retrospect, I should say I had it coming because for a long period of time I had been abusing my body by burning myself in front of a computer. It would be early for me if I went to bed before 2 a.m. And I thought I could get away with it. I thought as long as I get up as late as I want, doing some exercise on yoga mattress, do some occasional jogging, I thought I could get away with it. And I was wrong about that. The next day morning, things didn't get better, and I still didn't take it very seriously because I had stiff necks before, and usually it went away in days or maybe a week or so. The next day morning, it was even worse. I couldn't bend even slightly or turn it. Putting socks on was kind of hellish task for me. I still didn't take it very seriously, and normally I don't concern myself with hospital. I did some massages and some traditional fire cupping treatment. Somehow the pain reduced somewhat in a month, but something definitely wrong, and I feel it. My arms were getting weak, and I had numbness on my tip of the thumb and index finger, developing towards the middle fingers and pinky. And often I felt kind of chill on my arm, on my forearm, this side, and also on the back of my hand, kind of chill or coldness. When my hands were at weakest moment, I couldn't even open bottle of mineral water. I was troubled, but I was still in hope with physical therapy. I had no slightest idea to relate my problem with surgical solution until I faced MRI result and what the doctor said about it to me. Let me show you my MRI. As you can see, the stenosis, which is pinching, has been serious. Several doctors had asked me the same question, like, did I feel stepping onto the cotton when I was walking, which was not, never occurred to me. I think because to them, the pinching was so serious that even the lower limbs are likely affected. Becoming like this, it had to be taken very long time, maybe years. It was also possible that I was born that way, born with a nerve passage narrower than average people. Looked like I was an insensitive person with a tough nerve because I really didn't have obvious symptoms before. So the doctor says my condition was definitely surgical. So front or back? Anterior or posterior? But the doctor recommends to take posterior. Concerning cervical surgery, mostly are ACDF, anterior approach. It seemed to obviously having advantages like smaller cut, quicker recovery, and shorter operation time. I often read the ACDF patient can be home on the same day of the operation. So why, in my condition, has to be a posterior surgery? Well, despite all the advantages, the front approach only can be effective to release the pressure from front, which is caused by slipped or herniated discs. If major pressing is from the back, the surgical solution should be from back. There are also sometimes you can have choice when this shape, the pressing is from both sides, so the doctor may be able to choose between a posterior approach or anterior approach. Surgery took 3 hours. The cut was closed with 12 stitches. I entered the operation room 2 p.m. and rolled out at 8:30 after regaining consciousness. Process of recovery was not a breeze. I would say a full physical recovery took me 7 months. I could not leave bed for 3 days. Even what I often read about the patients after ACDF can go home at the same day, wow, I think it was optimistic. None of my fellow patients who had ACDF did that. I was discharged from hospital 5 days after the surgery. On that day, getting to the car was like a very awkward movement because from my waist up, my body was rigid. The stitches should be removed in 7 to 10 days. In my case, it was 13 days. And you are supposed to wear supporting collar for 1 month. But of course, you can remove it when you lie flat in bed. The revisit schedule recommended by hospital is month 1, month 2, month 3, and month 6. This picture was on day 50. The wound, the cut, has become flatter. I had a picture earlier than that when I have these stitches removed, and the picture was not beautiful. The stitches are pretty uneven, so I didn't keep it. I had my first full shower on day 20. On that day, I felt I could move my head up and down slightly, and for the first time, I could look down when I pee. On day 23, I did first shaving. I could remove collar for longer time, and my arm could do some simple moves, such as patting, twisting. Maybe I forgot to mention, for the posterior surgery, the movement of arms are very much restricted. After week 4, I could remove collar for a longer time than before. I could do the squats like 50. Week 5, I felt still a little bit of pain, but I could walk without collar. On day 40, I can live without collar. Day 47, I could bend down and touch the ground. Week 10, I started jogging. Week 11, I started playing guitar, which is very important to me, and it is a big sign of full recovery. Before that, the numbness on the fingertips made it impossible to play guitar because it requires such delicacy to have your instrument under control. Before that, I really had doubts because once the test with needles and the electronic device says I had neurogenic damages on both of my upper limbs, which is really worries me because it says it could be unrecoverable. Okay, that is machine language, and I know even I had such called neurogenic damages, I can play guitar. So it was such a big relief for me. Week 12, I start going to gym, jogging. 3.5 months, I start swimming. 4.5 months, I start doing push-ups. 6.5 months, no constraints at all. Is it surgical? The number one reference, of course, is the doctor's opinion. Standard procedure usually starts with a conservative approach first. Medicine, physical therapy, and spinal injection. When all these do not work, doctor may recommend surgical solution. But sometimes there's no clear defined cut line. The patients may be insensitive or oversensitive to the symptoms. What really matters is how you feel. So here, the questions being, how much does it affect your life? Or can you live with it? The next important question is, will it become worse? Maybe it's possible to cure it once for all if you correct all wrongs, like wrong posture of sitting, wrong posture of reading, wrong posture of working in front of PC. If you correct all these wrong habits, plus doing some exercise regularly with discipline, it is still possible to cure it once for all. But you really need to maintain your exercise habit. The symptom has become too serious. Maybe the non-surgical treatment has become too late for that. So in this case, maybe it's time to consider the option of surgical solution. Also, sometimes people have innate situation. They are born with narrow passage. With aging, the degeneration of the bones can only make it worse. So in such circumstance, it's time to consider the option of surgical solution. Speaking of seriousness of symptom, from my non-professional point of view, in the order from slightest to the most serious symptom is soreness, next pain, next tingling, and the worst, numbness, which is in my case too. Being a guitar hobbyist, when I felt the numbness on my fingertips, then I knew I should not wait any longer. So there's a question of success rate. Well, my online search showed quite positive statistic about ACDF. So for the patient who had ACDF, have 83 to 97 up to 100% of success or improvement, let's say. I will put the link down there. Anyway, let me read. The surgery has a high success rate. Between 93 to 100% of people who've had ACDF surgery from arm pain reported relief from pain, and 73 to 83% of people who had ACDF surgery for the neck pain reported the positive results. But I noticed it's talking about the pain. Pain is the lighter level of the problem. The worst is numbness on the hand or arm. That was not mentioned. But interestingly, this article also talked about second surgery. So 10% of patients developed pseudoarthrosis, and also there's a adjacent segment degeneration, 21%. That was a result in 10-year follow-up period. So the online search is quite optimistic. On the other hand, I knew a person, very close relative, like Carson. He had this surgery too, but he had like zero improvement. His problem is numbness on the hands. Maybe he has missed the best chance. Maybe he hesitated for too long. He hesitated for a year about it after the suggestion of the doctor. And 1 year later, he finally did it. There's no obvious improvement. Then 3 years later, the same doctor recommended to make this posterior surgery. 1 year after surgery, he also felt no improvement. So this is another side of the story. I would like to remind you about 10 to 21% developed problem in 10 years. This one we should be aware of it. In my opinion, even the surgery is very successful, the problem is not gone once for all. If you still keep your unhealthy habits, and if you don't do the exercise regularly, it may come back, Even the bone degeneration along with the aging could make something occur. So I would suggest do some exercise daily, simple like this. 10 times of this nodding. 1, 2, 3, 10. And 10 times of this shaking. 1, 2, 3, 10. Or maybe like this. Be careful. So maybe just do it at least once a time. It takes you maybe 20 seconds. Well, okay, anyway, the matter is a little bit complicated. I hope the information contained in this video can help some people. Bye.